Welcome! This module will provide an overview of health and physical development items, one of the essential domains of school readiness and Vermont's unique tool in determining school readiness, the Ready for Kindergarten Survey. The health and physical development domain has 6 questions. For each question, teachers may rate children using one of 3 scores: disagree, somewhat agree, and strongly agree. For every question, a detailed description is provided for each level of mastery. This is called a rubric for ratings. In the Ready for Kindergarten survey, this rubric for ratings can be found below each question. This rubric assists teachers in accurately recording what children know and can do in relation to the question of interest. The examples provided in this video are classroom-based. However, viewers are encouraged to think about how these questions could be answered based on feedback from family members about what their children know and can do at home and in the community. Let's take a look at the first item. Physical development item 1. A child demonstrates age-appropriate health habits and practices. There are many opportunities for teachers to observe these skills at school. Some of those opportunities may be toileting, wiping a nose, washing hands, or children putting on or taking off clothing. This might be a good question to ask family members too, as they can provide great insight into their children's abilities, especially skills that may not be as observable at school. For example, brushing teeth. Physical development item 2. A child is well coordinated in gross motor movements. In examining children's gross motor movements, we're looking for 3 things: increased stamina and endurance, movement with balance and control, and spatial awareness. Physical development item 3. A child's eye-hand coordination and fine motor skills are sufficient for exploring the learning environment. There are many examples for fine motor skills provided in the rubric for ratings document. For example, a child might demonstrate eye-hand coordination when using scissors to cut on a line and turning paper as needed, or stringing beads onto a string. Child behaviors that show their control of fine motor muscles includes holding pencils, crayons, or markers in a pincer grasp, or completing puzzles. When rating children's level of mastery for this item, the distinguishing characteristic between ratings is whether children are demonstrating these behaviors consistently, usually, or rarely. Health item 1. A child arrives rested and maintains an energy level necessary for learning throughout the day. Here are some examples of what teachers might see if children's energy levels are low or if they arrive to school without adequate rest. Health item 2. A child's full participation in learning is not affected by illness or missing school due to illness or lack of good physical health. For this item, teachers should pay attention to children's health both at school and if they miss school, finding out why they are absent. For example, is it due to a lack of good health or a family vacation? To fully document and rate this item, teachers may need assistance from staff in the school office and family members. Another element of this item, particularly if a child is rated as a disagree for this question, is whether the absences are impacting their social and academic outcomes. Health item 3. A child begins the morning class time well nourished. This is an item where teachers might want to talk with school staff who interact with children immediately upon arrival to school. For example, morning kitchen staff, outside playground supervisors, or before school leaders. A child's needs in this area might be met prior to the child reaching the classroom, and the teacher may not know what is happening. Teachers should seek input and observations from other adults whenever they are unsure of how to rate a child. Here's a chance for you to practice. What rating would you provide? Examine these pieces of documentation and answer the following questions. Question 1. Which health and physical development item do you think can be measured for this child? Question 2. Using the rubric for ratings, what level would you rate this child at? Please pause this video here and begin again when you're ready to hear the answers. Answers. Question 1. Which health and physical development item do you think can be measured? The health and physical development item that can be measured is Physical Development 1. A child demonstrates age-appropriate health habits and practices. Question 2. Using the rubric for ratings, what level would you rate this child? Based on the rubric for ratings, this child could be rated as performing independently for this item. Thank you for watching this module on health and physical development items, one of the essential domains of school readiness and Vermont's unique tool in determining school readiness, the Ready for Kindergarten Survey.